Welcome back to Med School Radio. It's about 2 a.m. But we're going to read first aid, the cardiovascular section. We're looking now at resistance, pressure and flow, and cardiac and vascular function curves. So first, regarding resistance, pressure, and flow, we're going to skip over the formulas and we're just going to read the summary notes. Remember that capillaries have the highest total cross-sectional area and the lowest flow velocity. Pressure gradient drives flow from a high pressure to a low pressure, and the arterioles account for most of the total peripheral resistance. And remember that veins provide most of the blood storage capacity. Next, viscosity depends mostly on hematocrit, and viscosity increases in hyperproteinemic states, for example, with multiple myeloma or with polycythemia, but viscosity decreases in anemia. So remember this formula for compliance, the change in volume over change in pressure. Okay, next let's look at the cardiac and vascular function curves. So if you're looking at First Aid 2019, page 284, you will see these amazing figures, which are not easy to figure out, but the more you look at them, the more you get used to them. But let's look at the summary notes here. First, regarding inotropy, then we'll talk about venous return, and then total peripheral resistance. First, inotropy. The effect. The changes in contractility lead to altered stroke volume, which leads to altered cardiac output over venous return and right atrial pressure, or RAP. So examples of this positively would be catecholamines, digoxin, and exercise. This would be positive inotropy. Negative inotropy examples would be with heart failure with reduced ejection fraction, narcotic overdose, and sympathetic inhibition. Okay, next let's look at what it says about venous return. Okay. So the effect, changes in circulating volume lead to altered RAP, or right atrial pressure, which leads to altered stroke volume, which leads to a change in cardiac output. Examples here positively and negatively. So first, positive venous return. So you would see that with fluid infusion and with sympathetic activity. And negatively, you have a negative venous return with acute hemorrhage and spinal anesthesia. Next, total peripheral resistance. What is the effect? Changes in total peripheral resistance lead to altered cardiac output. So remember that a change in the right atrial pressure is unpredictable. So the examples positively and negatively, a positive total peripheral resistance change, you would see this with vasopressors, and negatively with exercise and an AV shunt. So finally, the final note, it says at the bottom of the page here, changes often occur in tandem and may be reinforcing. For example, with exercise or increased inotropy and a decrease in total peripheral resistance to maximize cardiac output, or compensatory. For example, with heart failure, there is a decreased inotropy, which leads to fluid retention, to an increased preload to maintain cardiac output. So thanks very much for joining me for this Bedtime First Aid episode.